Parents, the first question we typically get in our office when it comes to helping their kids overcome some tough struggles is how long will it take for them to get over this, to help them through this? How long does it take? That's a really simple question, and there's not really a simple answer, but the short answer is that most parents don't want to hear that it depends. The reality is most parents are bringing in their kiddos to us after they've tried a lot of things. Some of them, they've even tried chiropractic already, and it just didn't work. Typically, there's a reason for this. You need to find a doctor who will give you an individualized care plan. Most offices nowadays have a very general recommendation for healthcare and for anyone that walks in. You walk in and it's the same procedure for pretty much every patient that comes in. So if they're not basing it and their recommendations off of what they're measuring on a case-by-case basis, this is when we don't see the results that we are looking for, especially the progress that we're looking for. When we are looking for a root cause approach to neurological healing, we have to look at a care plan for that patient or that child. And not everyone wants to hear that answer because care planning is not easy. It takes time, it takes repetition, it takes frequency, and it takes a lot of commitment. But that is where we see our results in our office. Now, this care plan is not just based off of one symptom or the primary reason that they're coming in, because oftentimes that is why they're coming in. But there's a multitude of factors that we have to take into account when we look at their case history. One comment we always get from parents is that we have a very thorough health history. Sometimes it takes them 30 minutes to fill out this history or our intake form because we ask about everything. We ask about their birth process, we ask about stress during pregnancy, we ask about what foods they're eating, what their habits are, what their bowel movements look like, how consistent they are. We look all the way back to when they were babies and preconception because we need to know, when did they hit these milestones? Did they skip any steps? Were there any early signs of stress in this child? We look at how many times they've been on antibiotics, how frequent they had tantrums when they were 2. Did they headbang or have ear infections? Some questions that parents may not even find relevant to the current issue, but all of this matters to us and we take this all into account. Every single question that we ask in our health history has the underlying search for every aspect of stress being stored in that child's nervous system and body. This gives us a clearer lens at which to look at the picture that is painted for us with the nervous system technology that is basically what we're measuring to see how deeply rooted this issue is and where it's being stored in the body. When we combine the 3 nervous system scans that we take in our office, we can measure how that body is responding to the environment, along with a detailed picture of their health history. Then we can use all this information to formulate a specialized care plan for this child individually. This involves 2 aspects. Their time it's going to take based off of our experiences with similar cases that this child is coming in for, and the frequency it's going to take to get that brain and that nervous system back to being in a calmer state again. So this also depends on the age of the child. How long have they been dealing with this specific challenge? Or even how long they've been showing signs of stress. So it might be not this challenge that they showed signs of stress of when they were little, but it's morphed into this bigger issue now. Even if mom thinks that they grew out of these challenges early on, like I said, it's morphed into a bigger issue now. So on the second visit to our office, after we've taken that detailed case history and consultation process and we've measured the child's nervous system with those objective scans that we have in our office, we then sit down with parents and go over exactly what we're seeing objectively on the scans with no bias whatsoever. And then we relate this to their history and what the parents were mentioning about their entire childhood and their birth process and all the different details. Parents get to see what is keeping their child in a state of fight or flight constantly, and they can see why it seems to take their child forever to wind down for bedtime, or how they can go from 0 to 100 with emotions and impulsivity into a tantrum for no real reason at all. Just quick little things that are really affecting their quality of life. Then our expertise comes in with tailoring that individualized care plan based off of our experience with similar cases like this child's and seeing them respond well to this care. And yes, it does look a lot different and more intensive than other chiropractic offices, which we are constantly telling parents that this is different because we take a very intensive approach in the beginning that ends up being worth it for them because they're getting that progress. And so other specialists, other chiropractic offices may recommend they come in whenever it's a big issue, but we look at the small, minute issues and we try to work on those first. And the frequency is really what creates that neurological shift for the kiddos in their brain. Sometimes and oftentimes we actually see improvements in other areas that are different from the parents' concerns originally, which is also really cool too. What we see most commonly improve first are the basic functions of the body, like sleep, emotions, and energy levels. These are things that we don't commonly associate with chiropractic care, but in our office, these are actually the most common symptoms that we see initially. These are all signs of nervous system adaptability, which is our goal for all of our patients. We want to be adaptable, resilient human beings. And these basic improvements lead to bigger milestone improvements. And this is why we are so big on care planning for these complex cases. A lot of times we will have a lot of wellness families that come in that just want maintenance care because they're already at a good place. And that's great too. Those are our favorite families as well. But we specialize in those complex cases where realistically, like sometimes we're their last hope, and it's pretty hard and awful to see that, and parents are just at a loss for what to do for their child. So the care plan gives us predictability, which is super important, so we can expect to see certain improvements by a certain time in that care plan and know exactly what to expect first before those bigger issues and those big goals that the parents have improve later on. So if this sounds like your child, or if this sounds like your situation where you've brought your child to many specialists, many chiropractors, many different health practitioners, and you're not really getting the root answers or the results that you're looking for, please give us a call. Let us know if we can help you. Explain your child's situation and your history, and we will try to take a deep root cause approach to make sure that your child gets the answers and the progress that you're looking for.